Hello, my dear nursing aspirants. Welcome you all to the Master Nursing classes. In the last previous class, we have discussed the most of the important questions on the OBC manuals on the in the management of the shoulder dystocia. I have discussed all the manuals like McRoberts maneuver, Rubin maneuver, okay, and all four maneuver. There is the Gaskin maneuver, Javanale maneuver. We have studied the theory plus image-based questions and those important points that may strikes in our exams. Everything I have covered in the last class, and this is the continued part of the OBC manuals. That is the separate video, and this is the separate video. Okay, so just take a note of this particular class where I'm throwing you a golden word. Okay, so it takes us a lot of the time to prepare the content, that is a very quality content, to deliver a perfect rank deciding content towards the our aspirants. So my request is, who is watching the master nursing classes first time, so please do subscribe to the channel and hit a like button, so that helps us to get boost more and to deliver the more important content towards you people. In this entire complete session, I am trying to explain everything in a very simple English with a regional language wherever necessary. ಕನ್ನಡದಾಗ ಬೆಂಕಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೀನಿ, ಕೇಳ್ತಾ ಇರ್ರಿ, ಹಂಗ ಕ್ಲಾಸಸ್ ಸಪೋರ್ಟ್ ಮಾಡ್ತಾ ಇರ್ರಿ. ನೀವು ಸಪೋರ್ಟ್ ಮಾಡ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಯಾರು ಸಪೋರ್ಟ್ ಮಾಡ್ಬೇಕು ನಮಗೆ, ಹೌದಲ್? ಸೊ ಸ್ಟೇ ಕನೆಕ್ಟೆಡ್. ಐ ಆಮ್ ಹಿಯರ್ ಟು ಡೆಲಿವರ್ ಅ ಕ್ವಾಲಿಟಿ ಕಂಟೆಂಟ್ towards you people and updated content towards you people, and the content that strikes in the exam towards you people. Yes, without wasting the time, we will start the today's class. And the theme, the thought that you people know from today's class is no smoking. Say no to not to smoke towards your to your peoples surround you, because students understand that the smoking is the thing that kills the people. Not only a smoker, it kills the people who is surround of that smoker. As a medicos, as a nursing aspirants, you people know, I think heard the word, that is the passive smokers or the second hand smokers. The passive smokers and second hand smokers, they won't go to the smoking center and they won't smoke, still they will get the lung cancer. How means, the active smoker or a particular smoker who smokes the thing, he will exhale that particular smoke out in the environment, and the person that may be a small kid, that may be a pregnant woman, that may be a immunocompromised patient surround of your environment. If that particular high risk age peoples, if they inhale the smoke which a smoker exhaled in the environment, means they are also getting the chance of the lung cancers. In pregnant woman, there is chance of the some congenital anomalies in the growing baby. So this is the very much dangerous to the environment. So have to advise the people, especially the community health officers who is working at the periphery. You people have to advise to the people not to smoke in the public places. If they want to smoke, let them to go and smoke in the private spaces. Okay, so give advice to the your surrounding people, make them aware and educate. So say no to smoking because it kills, right? So this is the thought and theme of the day. So we'll start the our class, and here is a beautiful motivation, beautiful first question in front of you. First, I will build a basic for each and everything. Okay, so directly I am going to the maneuvers, and I am telling that yes, the Pinard maneuver is the best and first maneuver which is used to handle the frank breech. I am telling here means, if people can't understand, first you have to understand what is frank breech. What is the frank breech? You people have to understand, then you people only are able to understand the what is Pinard maneuver. So studying the maneuver is a technique, and understanding a maneuver is the knowledge, and choosing the answer in the exam is the excellence. So students, study with the basic, have a knowledge, meet the excellence. So that is the special thing which comes out from the master nursing classes. Okay, if anyone is watching the video first time, so please do subscribe to the channel. Okay, and while are live to the session, yes, give answer in the comment box. Then Yes, please do answer in your comment box. So I'm trying to respond to your questions also. Okay. So without wasting time, so we'll start the class. What is the most common type of the malpresentation in labor? Most common type of the malpresentation in labor. Option A is the bridge presentation. Option B is the shoulder presentation. Option C is the face presentation. Then option D is the cephalic presentation. So which one is the most common malpresentation? First, you people have to understand what is malpresentation. Student, consider this is a pelvic inlet. In this one, the head of the baby is there. This is called as the cephalic presentation. This is called as cephalic presentation. Other than this, any presentation which is lying here in the pelvic inlet, so that is called as the malpresentation. Consider this one as a pelvic inlet, and here the buttock of the baby is there. This is the malpresentation. That is the breech malpresentation. Consider this is the pelvic inlet, and here the shoulder. Okay, the shoulder of the baby is there. So this is the shoulder malpresentation, right? So except cephalic presentation, all are malpresentation. Clear, bacho? If the face is here, means that is the face malpresentation, right? So only one presentation is normal, that is the cephalic presentation, and other all presentation are the malpresentation. So the most common type of the malpresentation is the, yes, option D. I have told it is the normal, so it's not a malpresentation, it's a normal. So I'm eliminating the option D here, right? So our correct answer, yes, almost all you people have chosen the option A as the correct answer. There is a breech presentation is the most common type of the malpresentation, and it is your correct answer, right? It's your correct answer. What is the breech presentation? I have told here just the breech presentation is the, this is the pelvic inlet, and here the buttock. The buttock of the baby is lying in the pelvic inlet or in the lower uterine cavity. Okay, in the lower uterine cavity or in the pelvic inlet, the buttock of the baby is lying, means this is what you call as on the breech presentation. The question will come in your KE exams or else in your NARCET exams and RRB exams. Important question, right? So this breech presentation we also call as a podalic presentation. Podalic presentation, very very important, right? So the next question is, just read the question and try to give the best answer for this one. Which of the following is a common cause of the breech presentation? The most common cause of the breech presentation. You have to choose from the given options. Yes, all four options are responsible for causing the breech presentation, but the question is the common cause of the breech presentation. Yes, the question is related to the common cause of the breech presentation. I want your active participation in the comment box. So who all are live to the session, so do comment in the comment box, right? Which of the following is a common cause of the breech presentation? Option A is the prematurity. Option B is the placenta previa. Option C is the hydrocephalus. Option D is the polyhydramnios. So what is the correct answer for this one? Yes, the most common cause of the breech presentation is the prematurity and preterm delivery, or we can say preterm labor and prematurity is the most common cause of the breech presentation. Yes, it's very very important. This is the a single best answer. Okay, it will comes in your exams. Okay, so here is the next question, right? So what effect does oligohydramnios have on breech presentation? So what is the effect of the oligohydramnios on the breech presentation? So first let me tell what is oligohydramnios. Oligohydramnios means less amniotic fluid. This is in general, okay? But as a diagnostic criteria, when you will do the amniotic fluid index, it would be less than 5 centimeter. And when you will check the single largest pocket volume of the amniotic fluid, it should be less than 2 centimeter. Okay, so it indicates amniotic fluid index less than 5 centimeter. Single largest pocket volume of the amniotic fluid is less than 2 centimeter. So we call this one as the oligohydramnios. Okay, we call this one as the oligohydramnios, right? So how it affects the or how it contributes for the bridge presentation. What is the contribution of this oligohydramnios for the bridge presentation? Option A is telling it helps the baby to turn spontaneously. बच्चों, there is no space. As I told, this is the uterine cavity, and inside there is less amniotic fluid. Means this is the amniotic cavity. Inside this one, there is less amniotic fluid. Okay, only less amniotic fluid means it will not allow the baby. It will not allow the baby to rotate. Means it not helps to turn spontaneously. It helps to baby turn spontaneously is the incorrect statement. I am eliminating option A. Okay, option B, it prevents the baby from turning. Yes, we can say. So there is less amniotic fluid, means less space inside. It indicates the less space inside. So due to the less space, baby can't turn spontaneously. So that is the baby is unable to turn spontaneously. It causes the bridge presentation. How? Yes, here is one concept all people have to understand how the less turning of the baby may contribute into the breech delivery. Yes, sorry, breech presentation. Okay, so consider when you will do the ultrasonography. Okay, so this is the head of the baby. When you will do the ultrasonography at the 28 week, this is the buttock of the baby, right? So at the 28 week, there is 28 percentage chance of the breast presentation. Okay, for the same pregnant woman, if you are doing the ultrasonography at the 34 weeks, this pregnant woman may get turned her baby to the cephalic presentation in the most of the cases, and only 3 to 5 percentage cases the baby will not turn, right? So at the 28th week of the gestation, 28% of the babies are breech presentation. When you will check for the 3 to 4 at the 34 week, only 3 to 5 percentage babies will be in the breech presentation. Means there is a word called as the spontaneous internal rotation. So it means the baby spontaneously inside the uterus, it will rotate and it will comes to the normal presentation, that is the cephalic presentation. Okay. So if in case here the amniotic fluid is very less, amniotic fluid is very less, means baby unable to rotate, it will remain into the breech presentation, and the increases the risk of the breech presentation. And if in case the baby is connected with a very small umbilical cord, okay, with very small umbilical cord means again baby will not rotate, means baby will remains in the breech presentation. Or if in case the baby is a preterm or premature, means its muscles are very atonic. Okay, means baby is not having the power to rotate, means the baby will remain same in the breech presentation. Okay, the first one is the oligohydramnios increases the risk of the breech presentation, and second one is yes, atony or the muscle weakness of the babies increases the risk of the what we can say breech presentation. And most second, sorry, third one is the short umbilical cord increases the risk of the breech presentation. And along with that, if in case the two babies are there inside the uterus, means twins pregnancy, also where the less chance of the spontaneous internal rotation. So the baby is not spontaneously rotating inside, means it is again inside the uterus, it will stay in the breech presentation only. So twins also increases the risk of the breech presentation. Okay, so remember these four conditions where the baby remains in the breech presentation and baby unable to spontaneously rotate inside. That is the first one is the very importantly, yes, short umbilical cord and oligohydramnios and twin pregnancy and preterm labors, right? So here in this case the baby will not rotate spontaneously, so the baby will remain in the breech condition. Okay, so like that, here the oligohydramnios, how it may promotes the breech presentation means it will not allow the baby to rotate inside, means it prevents the baby from turning. It prevents the baby from turning means the baby is not turning from the breech to the cephalic, means it increases the risk of the breech presentation, and this is the correct answer for this question, right? So option B is the correct answer. Okay, so the next option is it has no effect, means this is I'm eliminating here. Okay, so it causes the baby remains head down position. No, baby will not remains in the head down position. In the breech presentation, baby's head will be in the up of the uterus. Okay, so in the breech presentation, so this is the pelvic, means the baby's head will be here and the buttock will be here. So that is only we call as the breech presentation, right? So I hope this particular concept and question is clear for you all, right? Yes, right. So here the next question: what is the most common type of the breech presentation in the primipara mother? What is primipara? Primipara means the mother who is first time pregnant. Sorry, who is first time able to give the delivery, or we can say who is primigravida means she is first time pregnant, and primipara means she is first time able to give the delivery, and her pregnancy which crossed the period of the viability. So that is what we call as the primipara. Okay. Yes. So in the primipara mother, so the most common type of the breech presentation in the primipara mother. The answer is option A complete breech, option B frank breech, option C footling breech, option D knee breech. So I will deal with all kind of the breech with image based question. Okay. So I am having here, stay tuned, like, okay, and start to give your answer here. So what is the most common type of the breech presentation in the primipara mother? If the question in the primipara mother and overall most common, and in the primipara most common is the our frank bridge. Okay, so I will tell what is frank bridge, don't worry. Okay, take a note of this one. Overall most common type of the bridge presentation frank bridge, and the most common type of the bridge presentation in the primipara also frank bridge. If in case the question is like this, the most common type of the bridge presentation in the multiparasumam, the multiparasumam, so your answer would be the complete bridge. Okay, so then let me go for the what is the frank bridge, what is the complete bridge, or how we have to identify, sir, where there is a chance of the image based question is there or not. Yes, there is 1000% chance of asking the image based question will be there. So that is the reason I have brought these images in front of you all. Okay, and it is very very important. Okay, first we will discuss the complete bridge, then I will come for the frank bridge, then I will discuss the footling bridge. Okay, then after that I will discuss the kneeling bridge. Okay, and after that we will discuss the star gauge bridge. So all these five type of the bridge with a specific golden point I am giving here is the most important. Okay, so look at me first. So the complete bridge means the complete this particular pelvic inlet is completely covered with the foot, the external genitalia, the buttock, and the coccyx of the baby. Okay, so very very importantly, when we will do the per vaginal examination, we are able to feel the foot, the external genitalia, the two buttocks, and the coccyx of the baby in the complete bridge. In the complete bridge, and in the complete bridge, when you will see the hip is flexed here completely, right? Look at here, the hip is completely flexed, and when you will come to the knee is completely flexed. What is flexed? Flexion means it's a decrease in the angle of between the joints. That's called as the flexion. Okay, this is the decrease in the angle between the joint. So the angle between the joint is decreased, it means there is a flexion, and angle between the joint is increasing. Right? The angle between the joint is increasing, that is called as the extension. The angle between the joint is decreasing, that is called as flexion. So here also the universal position of the fetus, the examiner asking is all, each and every part of the baby is completely flexed. Okay, yes, that is what we call as the universal position of the fetus is complete flexion is the universal attitude of the fetus, we can say, the or universal position of the fetus, we can say, that is the attitude and position, that is the complete flexion. Okay, very very importantly, here also in the complete breech, the hip is also flexed, the knee is also flexed. Okay, and the buttock is staying in the inlet of the pelvis. Okay, when we will do the per vaginal examination, we are able to feel the foot, buttock, external genitalia, and coccyx of the baby. But in the frank presentation, the frank breech, or we can say the extended breech presentation. So in this one, the hip is flexed, but the knee is extended. The knee is extended. Hip is flexed, knee is extended. So that is what we call as the frank breech. Okay, when we will do the per vaginal examination from this side, so we are unable to feel the foot because the foot is here above. Okay, so in the per vaginal examination, we are unable to assess the foot. Okay, except foot, everything we can assess, like external anal sphincter we can see, genitalia, external genitalia we can feel. Okay, both side buttocks we can feel, and coccyx from the posterior also we can feel. But in the frank breech, we are unable to feel the foot because the foot are above towards the face of the baby. Okay, so this is here the knee is extended completely. So this is what we call as the extended breech. Extended breech. Okay, so very very importantly, so then I will coming to the next one, that is the footling breech. In the footling breech, as all of you know, that the foot is down here. Okay, so the foot is down here. So the foot which crosses the inlet of the pelvis and which will comes down, so that is what we call the footling breech. So when we do the paravaginal examination, only foot we can able to assess here because it is prominent and it is dominating the entire body. Okay, so that is what we call the footling breech. Then I will coming for the kneeling breech. Okay, so here the hip is extended and knee is flexed. Okay, so when we will do the paravaginal examination, we'll feel the knee here. Okay, we'll feel the only knee we are feeling, means that is the kneeling breech. Only foot we are feeling, means there is a footling breech. Foot and external genitalia and anal sphincter and coccyx we are feeling, means there is the complete breech. Only external anal sphincter, genitalia and coccyx we are feeling, means there is the frank breech. So now tell me, what is the overall most common type of the breech? Overall most common type of the breech is the frank breech. And most common type of the breech in the primigravida, most common in the primigravida, that's the frank breech. Okay, the most common in multigravida, multigravida we can say, or multiparas also we can say, no problem. Okay, so both not same, but for this question it is same, right? The most common in the primipara, that is the frank breech. The most common in the primigravida is the frank breech. Overall most common is the frank breech. The most common in the multigravida also complete breech. Most common in the multiparas also complete breech. Okay, so then comes to the footling breech. This footling breech is the breech with the highest risk of the umbilical cord prolapse. Okay, so the question will come. Look at these images, first and second. In this one, the pelvic inlet is completely closed. Okay, means the umbilical cord will not comes down like this, right? So there is less chance of the umbilical cord prolapse in the frank breech and complete breech. But look at the image, third image, this one. Here this side is open, this side is open, means that this particular pelvic inlet is not completely closed here, means there is chance of the prolapse of the umbilical cord. Okay, so the highest chance in which kind of the breech? The question will come, which of the following breech presentation is manifest with the highest chance of the umbilical cord prolapse? The answer is footling breech. The answer is footling breech. Okay, this is the first best answer, and the second best answer is the kneeling breech. Okay, so this is the second best answer for the umbilical cord prolapse. So if the examiner are asking what is the most common overall cause of the umbilical cord prolapse. umbilical cord prolapse के लिए umbilical cord prolapse गोस्कर most common overall cause, that is transverse line. Okay, what is transverse line? Consider this is the uterus of the mother, and so this the baby is positioned in this transverse direction. Okay, so this is what we call as the breech. This is what we call as the cephalic. This is what we call as the cephalic. Okay, so these both are the longitudinal line. Okay, so both are showing the longitudinal line. Why? Because which are longitudinal to the uterine axis. The fetal axis is longitudinal to the uterine axis. But here in this particular situation, this is what we call as the longitudinal line. How? How means this is the uterine axis. For this uterine axis, this baby is in longitudinal position, or we can say the transverse position. Okay. Sorry. This is what we call as the transverse position, and these are both are the longitudinal position. Okay. So the baby here it is in the transverse position, right? Or we can say the transverse line. Okay, transverse line. So here the baby's umbilical can easily comes down because it is completely open here, right? So this is completely open here, so the baby's umbilical cord can easily prolapse here. So the most common reason for the umbilical cord prolapse is the transverse line. If the examiner asking which breech presentation is highest chance of the umbilical cord prolapse, is the examiner asking which breech presentation is the most common, means that then the footling breech is the our primary answer, right? So hope the concept is clear on this one. Okay, so let me write and make a more clear for you all, so that helps you all. Okay, so most common overall cause of umbilical cord prolapse, overall cause is our transverse line. Okay, so important point. Second important point is what is most common breech responsible for umbilical cord prolapse. So that is our first answer would be, first answer is yes, footling breech, and second answer is kneeling breech. And in these first two, frank breech and complete breech, here there is no chance of the umbilical cord prolapse. So vaginal delivery we can try in the frank breech and complete breech. But for the footling breech and knee breech, for this both footling breech and knee breech, always go for the LSCS. Okay, for the footling breech and knee breech, always go for the lower segment cesarean section. Okay, always do for the LSCS. It's very important. Okay, so we have seen the four type of the breech here. There is a frank breech, complete breech, footling breech, then kneeling bridge. Then I will come for the this star gauge bridge. So what is the star gauge bridge? So what we are able to see here in the ultrasonography, Bocho, look at this one. This is the thorax of the baby. Okay, this is the abdomen of the baby, and here are the foot of the baby, like this. Okay, and here it is the spine. Are you people able to see the spine here? Yes, and here is the neck, and this one is the face. This one is the nose here, right? This one is the nose, and these are the eyes. So look at the image. Here in this particular case, this is the pelvic inlet, and baby's neck is completely extended like this, and it is looking up to the sky and counting the stars. So that is the reason it is called as the star gaze bridge. Means in the bridge presentation, in all kind of the bridge presentation, look at this one, the head is flexed. Look at this one, the head is flexed. Look at the complete breech, head is flexed. Frank breech, head is flexed. But here the head is extended. Here the head is extended. And which looks like counting a star from the sky. So that is what you call as the stargaze bridge. This is what you call as the stargaze bridge, and this is clearly indicating that don't do any vaginal delivery. Directly go for the lower segment cesarean section. This is the clear indication for the LSCS. Bacho, as I told, in the complete breech and frank breech, you can go for the normal vaginal delivery. But footling breech, knee breech, and stargaze breech, don't try for the normal vaginal delivery. Here, in this case, you people have to go for the elective LSCS is the best method. Okay, so now we found and we have studied the risk factor, the types of the breech, what is breech, the most common type of the breech, overall most common, in multiparous most common, in primiparous most common, okay, and the most common cause of the breech, that is the preterm and premature delivery. We have studied everything. Now, how we have to manage the breech? Here it will actual game starts now. Okay, yes. So at what gestational age the external cephalic version will done? First, you people have to tell me what is the external cephalic version. Yes, as I told in the breech presentation, this is the pelvic inlet and this is the head of the baby. Okay, and this is the buttock of the baby, right? This is the buttock of the baby is down here. So this is the breech presentation. I will ask the mother to come to the hospital and without giving any anesthesia, I will place the hand on the mother abdomen externally. I will not insert the hand internally. Okay. So I will place the hand on the mother abdomen externally and I will try to rotate this particular breech presentation and I will try to convert this to the cephalic presentation. Means by external manipulation, I want to convert this breech presentation to the cephalic presentation like this. Okay, so this is the head of the baby now, and this is the breech. This is the buttock. We can say the podalic of the part of the baby, right? So with the help of the external manipulation, if I am trying to change the position from the breech presentation to the cephalic presentation, that is what we call as the external cephalic version. Means externally, I am rotating the breech presentation, I am converting this one to the cephalic presentation. So this is what we call as the external cephalic version. And when we have to perform this one, what is the most gestational age where I want to perform the external cephalic version? Yes, can anyone able to answer for this one? Yes, very nice of you all. So, and few students only answered this as correct. So that is the 36 to 38 week is the correct answer. And if you want a single best answer, the single best answer is yes. Can anyone choose? Yes, that is the 37 week of the gestation is the single best answer where we can do the external cephalic version. Okay, so it's very very important, right? Right, clear, Bacho? Yes. So here's the next question. So what is the most common cause of death in the fetus in breech presentation during the labor? So while delivering the baby with breech presentation, what is the most common cause of the death in the fetus? So how the fetus will die most commonly in the normal vaginal delivery during the breech presentation? Yes, your answer will be the option A, umbilical cord collapse. No. So I will tell directly the answer. Okay. So the answer is intracranial hemorrhage is the most common. Yes, all of you have given the correct answer. That is option B. That is the intracranial hemorrhage. This is the most common cause of death in the fetus during the breech vaginal delivery. Right. So in order to prevent this one, if the examiner asking the question most preferred route of delivery in the breech presentation means your answer is lower segment cesarean section is the preferred mode of the delivery. If examiner asking why means it is having the less chance of the intracranial hemorrhage. Okay, so in the LSCS, less chance of the intracranial hemorrhage, and LSCS is the preferred mode of delivery in breech. because of the less chance of the intracranial hemorrhage. Okay, if you are trying to deliver the baby through the per vaginally, there is chance of the intracranial hemorrhage, right? So in the LSCS, it is less. So the preferred mode of delivery in the breech presentation is the LSCS. Hope the concept is clear on this one, right? So here is the next question. Yes, which of the following is the preferred mode of delivery for breech presentation? Just now only I have discussed that is the cesarean section, or we can say the lower segment cesarean section is the preferred mode of the delivery. Okay, it is the preferred mode of delivery because less chance of intracranial hemorrhage. Okay, and another reasons also there. So what are the other reasons? But while delivering the normal baby, as I told, the normal is the cephalic presentation, means the head is here and rest body is here. In the normal vaginal delivery, in the cephalic presentation, I am talking about the cephalic presentation. Head will come out first. Head will come out first. Means the airway will come out first. There is no any difficulty in airway in the normal vaginal delivery. But in the breech delivery, look at the status here. In the breech delivery, the buttock is here and the head is here. Means while coming out, the buttock will come first. The buttock will come first. Means the head will come later. So this one we call as in the after coming head in breech. Okay. So what we call this one is the after coming head in breech. Means buttock come first, but the face is still inside the uterine cavity, means the airway is still not open, so there is chance of the fetal hypoxia. Okay, so the complication I am telling here to deliver the baby in breech presentation per vaginally, that is the there is chance of the fetal hypoxia. Because of this hypoxia, there is hypoxic encephalopathy. Okay. So what is hypoxic encephalopathy? Because of the hypoxia, there is damage of the brain. So this is what we call the hypoxic encephalopathy. And yes, the airway black is also chances is there because of the this after coming head here, right? So very importantly, all people have to understand here the head will come later and there is chance of the hypoxia, because of that there is chance of the damage to the brain also. Okay, so it is also very important, right? Yes, yes. So the question is clear here. The preferred mode of the delivery is the cesarean section, right? Here is the next question, and our topic starts now. Still, what we have studied is a basic thing and the important thing. Now, the actual maneuvers will start here. Okay, actual maneuvers will start here. Yes, which maneuver is commonly used to deliver the buttock in a frank breech presentation? Yes, before going to this question, I want to clear you on terminology. That is the yes, here it is. That is the ABD, the assisted breech delivery. Bacho, in the frank breech also, normal vaginal delivery happens. It will happens. If in case during the normal vaginal delivery, the buttocks are get stuck there, consider the buttock is get stuck there. Means at that time I have to do some maneuvers and I have to remove the buttock. Okay, consider buttock came out. Now the shoulder got stuck here. So then again I have to do some maneuvers and I have to remove the shoulder here. So consider the shoulder came out. The head is got stuck here. Okay, the head is got stuck here. Now again I have to do some maneuver and I have to remove the head. Okay, so in each and every step, if the normal vaginal delivery of the breech presentation is got stuck, means I am doing some maneuvers here, means in every step I am assisting the process of the labor. So that is what we call as the assisted breech delivery. So assisted breech delivery done in the yes delivery of the breech baby when it will get stuck inside the pelvic cavity. Okay, so that's the very important for you all. Okay, so right. So now the next question is, which of the maneuver is commonly used to deliver the buttocks? Okay, consider now during the breech delivery the buttock is got stuck. So The foot or the buttock are got stuck here in the frank bridge. So what is your maneuver you have to perform here? Yes. So what I told, this is the frank bridge. Okay. So look at the image. So this one is the frank bridge. Okay. So this one, first one is the frank bridge. Right. Look at the image. The hip is flexed and knee is extended. So now how you have to deliver this one? Okay. So in this one, we have to deliver first this foot, then the buttock, then the entire body. Okay. So first to deliver this foot, we have to do one maneuver. The name of the maneuver is, yes, all you people have to choose here. Yes, option is the Morris's smiley wheat maneuver. No, this is done to deliver the head of the baby during the breech presentation. Okay. So to deliver head, not buttock. Okay, head of the baby during the bridge presentation done by the Maurice Smiley with maneuver, or we can say this one as in the, yes, the, yes, molar flexion shoulder traction. We can say this one as also. Okay, so molar flexion and shoulder traction, I will come to this one. This is used to deliver the head of the baby during the bridge presentation, not buttock. Okay, I'm eliminating option A. So then comes to the pinard maneuver. Okay, so yes, what I told in the pinard maneuver, the hip is flexed and knee is extended. First I have to deliver the foot, means just I have to put pressure on the popliteal fossa. So what is popliteal fossa? So this particular area behind the our knee, so this is the baby's knee. Okay, so behind the baby's knee, this is this particular area we can call this one as in the popliteal fossa. Okay, so where the healthcare provider will apply pressure in the popliteal fossa, then the baby will flex his foot down. Okay, so it will flex his foot down, then I have to hold the baby's foot and I have to deliver this one like this. Okay, so I have to deliver this one. Okay, so again same for the next leg, I have to put pressure on the popliteal fossa and I have to hold the leg, so then I have to deliver the leg same. So I am putting the pressure on popliteal fossa. We call this one as the pinard maneuver. Okay, so how to remember, sir? Pressure in popliteal fossa is called as the pinard maneuver. This is used to deliver as the frank bridge. Okay, but it is not useful in the complete bridge. Why? Because in the complete bridge, already the foot is flexed. Right? Look at the image. In the complete bridge, the already foot is flexed. There is no any maneuver required to flex the foot. Okay, sorry, the already knee are already flexed. Okay, so there is no extra maneuver required to flex the knee. Okay, so the pinard maneuver is only useful in the frank bridge. It is not useful in the complete bridge. Right? So our answer here, is very very importantly. So the maneuver which is, let me take for the question. Yes, the maneuver commonly used to deliver the buttock in the frank is the our only and single best answer, that is the pinard maneuver. So groin traction maneuver also used, but this groin traction maneuver used in the complete bridge, not in the frank bridge. Okay, it is used in the complete bridge, where in the complete bridge, okay, so just in the groin. Okay, consider this is the baby. Okay, this is the buttock, and this particular area we call this one is in the groin. So here we have to apply the fingers and we have to pull that one. So we are applying the fingers in the groin and we are keeping the pulling pressure, that is called as the traction. So this is called as the groin traction maneuver. So the groin traction maneuver is done in the complete bridge. It is done in the complete bridge. Okay, right? Very, very importantly, in the frank bridge, we have to go for the pinard maneuver. In the complete bridge, we have to go for the groin traction maneuver. Okay, so then now our buttock of the baby is got delivered. Now the next part we have to deliver. The buttock is got delivered. Now the next part we have to go for the shoulder of the baby. Okay, so now give the answer for this one. The Lowset maneuver is primarily used for which obstetrician scenario? Yes, the Lowset maneuver is primarily used for the which obstetric scenario. Don't go for the option A, bacho. I have discussed this one, shoulder dystocia, and it's all maneuver in the shoulder dystocia only, right? Where we are going to use the Mc-Roberts maneuver, the single, best, and first maneuver in the shoulder dystocia. If the Mc-Roberts maneuver is failed, go for the wood corkscrew maneuver I have told, or we can say the Rubin maneuver. If that is also failed, in the last class we have discussed wood corkscrew maneuver also failed means go for the all four maneuver or the Gaskin maneuver I told. If that is also failed, so push the head of the baby into the uterine cavity and go for the this one, what we can say, LSDS. That is the Jamanelli maneuver last we have told. But in the shoulder dystocia, we have not studied the Lowset maneuver. So this is not our answer here. Okay. Yes. Lowset maneuver is used in breech presentation with impacted shoulder. What it means, sir? Bacho, previously while telling wood corkscrew maneuver, this one I have told. This is I have told to rotate where the posterior shoulder come to the anterior shoulder 180-degree. Okay, in the last yesterday's class. Okay, where the posterior shoulder came anteriorly here. Then I have delivered the shoulder. But this is in condition of the cephalic presentation. So to deliver the shoulder in the shoulder dystocia in cephalic presentation, wood corkscrew maneuver is used. But in case of the breech presentation, you are delivering the shoulder means you have to use this particular maneuver. That is what we call as the Lowset maneuver. Don't confuse. Okay, in shoulder dystocia to deliver the shoulder, which maneuver is used? That is the wood corkscrew maneuver. Okay, so in the breech presentation to deliver the shoulder, which maneuver is used? There is the Lowset maneuver. Okay, so what we have to do in the Lowset maneuver is like this. Okay, so we have to hold the baby's posterior, and this both thumb should be in the sacrum. Okay, at the sacral area. Then rotate this baby completely where the posterior shoulder should come anteriorly. Okay, so the posterior shoulder should come anteriorly. At that time, the posterior shoulder will get delivered. Again, the thing you have to repeat it back again. Okay, means rotate and rotate back. So this is called as the Lowset manner. But in the wood corkscrew manner, we are just rotating 180-degree. That's it. Okay. So here in the Lowset manner, rotate first. The posterior shoulder will come anteriorly. Then the posterior shoulder will deliver. Then again rotate back where the another side of the shoulder also get delivered. So this is the Lowset manner. There is less chance of asking the image-based question. Still, it's important. Still, it's important because the question will come in this theory format. Okay, right? It's important. Very, very important. Okay. So here's the next question for you all. Yes, the primary objectives when delivering the after coming head in the breech delivery. What I told the after coming head. Yes, in the normal vaginal delivery, what happens? This is the cephalic presentation. The head will come first here. The head will come first here. So this is the normal. In case of the breech presentation, where the buttock is down and head is up, means the buttock will come first and head will come last. So this last coming head we can say as the after coming head in breech. Okay, so it's important. What is the after coming head? Means the head will deliver at the last of the last part to get delivered in the breech is the head. First part to get delivered in the cephalic is the head. Right? So this is the very, very important point. You people have to consider here. Right? Yes. So the question is like this. The question is like this. Primary objectives of delivering the after coming head in the breech delivery. Bacho, remember while delivering the head in the cephalic presentation in normally, so the head will be delivered by the extension, by the process of the extension means we have to extend the head like this, and the head will come out during the normal vaginal delivery. Okay, but if in case while delivering the after coming head in the breech, the head will be delivered in the process of flexion. Okay, remember bacho, this will be your rank deciding point here. During the normal vaginal delivery, how we have to deliver the head? We have to deliver the head by the process of the extension. But during the breech presentation, that is the after coming head we are delivering, means we have to deliver this one with the process of the flexion. It's very very important. Okay, so the question is here, like, so, what is the primary objective we have to maintain while delivering the aftercoming head in breech delivery? So, option A is the rapidly extract the head regardless of the flexion. Okay, so we are regardless of the flexion, we are extracting the head, means the clavicle will get damaged, the cervical plexus will get damaged. So, option A I am eliminating here. And option B, maintain the flexion of the fetal head to minimize the diameter. Yes. So always while delivering the aftercoming head in the breech, always we people have to maintain the flexion. So it's very very important. And answer for this question is the option B, the maintain the flexion of the head to minimize the diameter, because while delivering the aftercoming head, I am maintaining the extension, flexion here means, so it will engage us in a very short diameter and the head will come easily out. Okay, so that is very, very important. Okay, so option C, extend the fetal head to facilitate the easy passage. Extend the fetal head to facilitate the easy passage. It is done in the normal cephalic vaginal delivery. Okay, so in the normal cephalic vaginal delivery, the head will get delivered by the process of the extension. As I told, in the breech, after coming head, the process of the flexion. 5 times I have repeated because it is important, right? So the question is clear here. Then option D is here, the rotate the fetal head to the occipito posterior position. So this is not our answer here. Okay, so the next question is like this. An important question. I am waiting for your answer in the comment box. So do comment fadafat. Yes. During the Mauricio Smiley White maneuver, where is the operator's finger position? ಈ ಮೊರಿಸಿ ಸ್ಮೈಲಿ ವೈಟ್ ಮ್ಯಾನರ್ ಮಾಡುವಾಗ ಆಪರೇಟರ್ಸ್ ಅಂದ್ರೆ ಹೆಲ್ತ್ ಕೇರ್ ಪ್ರೊವೈಡರ್ ಫಿಂಗರ್ಸ್ ಎಲ್ಲಿ ಪೊಸಿಷನ್ ಮಾಡಿ ಇಡಬೇಕು ಅಂತ ಕೇಳ್ತಿದ್ದಾರೆ ಕ್ವಶನ್. ದ ಕ್ವಶನ್ ಇಸ್ ವೆರಿ ಸಿಂಪಲ್. While maintaining the Morrissey smiley white maneuver, so here the operator should keep the finger. So first, you people have to understand where we have to use the Morris's smile white maneuver. So another name of this one is the, yes, molar flexion and shoulder traction maneuver. Okay, so this is the another name of the Morris's smiley white technique. Yes, option A is the on the fetal shoulder we have to keep the fingers. No, it is not correct. Option D, on the fetal buttocks we have to keep. No, it's not correct. Option C, on the fetal maxilla and suboccipital region. And all of you people have chosen this answer, and your answer is 100% correct. And no one can stop you to get rank in the upcoming NARCET exams. Keep preparing, bacho. So your preparation and your consistency is the only thing that lift you and which makes you to stand out of the crowd, right? So then option B is the one of the on the fetal abdomen. So this is also not our answer. So let me clear this one. Morrissey's what we can say, the Morrissey's smile with techniques, or we can say the shoulder traction, molar flexion and shoulder traction. Look at this one. The first hand is here in the molar. So these are our molar teeth. Okay, so or we can say the maxilla. Okay, here the two fingers from the posterior vaginal wall will come here. Okay, and it will be like this here and lock. And another hand it will come from the posteriorly, sorry, from the anterior wall of the vagina, and it will be at the suboccipital region. So this is occiput, and just behind the occiput, the area we call as the subocciput. Okay, so one hand is over the molar, and another hand is over the suboccipital region. So, with the help of this suboccipital hand, we have to push, and with the help of this particular maxillary hand or the molar hand, we have to pull. Okay, so look at the image here. So, we are pushing here and we are pulling here, means we are maintaining the flexion, means the head will comes out. Okay, so as I told, the after coming head in the breech position should be delivered by the process of deflection. So this is how, yes, the one finger will push like this and another finger will pull like this. So this is what we call as the Morris's small technique. So that is done to deliver the head of the baby in the, yes, in the breech presentation. Okay, in the breech presentation to deliver the head of the baby. So we have to use this particular technique. The name of the technique is our Morris's smiley wheat maneuver or the molar flexion shoulder traction. It's very, very important. Okay, so now we have delivered like this. Consider if in case, we are unable to deliver by this one, means we have to go for the Burn Marshall maneuver. So it's so very, very important. What is the Burn Marshall maneuver? Consider our entire baby, we have delivered the buttock. Okay, so buttock delivered by with the help of the which maneuvers? Two maneuvers. That is the in the front bridge with the help of the pinard maneuver, in the complete bridge with the help of the groin traction maneuver. Okay, so then we have delivered the shoulder with the help of the low set maneuver. Now the head is inside. Okay, so one maneuver to deliver the head we have studied, that is the molar flexion and shoulder traction, or we can say Morris's smiley wheel technique. And one more technique we are having here to deliver the head of the baby, that is our Burn Marshall technique. So the Burn Marshall maneuver is used to deliver which part in the breech, means to deliver the head in the breech presentation. That is the very, very important. First thing, we have to wait for the spontaneous delivery of the head. Because of the baby's weight, the head will comes easily because the baby is hanging here, means the flexion is maintaining. Means the flexion is maintaining means it will get delivery easily, right? Just a second, please. Right? What I'm telling here. So the baby is hanging here means the flexion is maintaining, means sometimes spontaneously head will comes automatically. So in this particular situation, just we have to maintain the support to the this particular lower part of the baby, and the babies will suddenly come out. If it is not coming out, means we have to go for this particular maneuver where we have to hold the baby's foot and will make the baby to turn posteriorly like this. The baby's foot we will push towards the abdomen of the mother. Okay, so where the baby's head will come out. So this is what we call as the Burn Marshall technique. Okay, it is used in the delivery of the head of the fetus in the breech presentation or the after coming head of the breech. Okay, it's very, very important. Then the another techniques we are having here is the Piper's forceps are specially designed for the, yes, for what purpose? It's delivered. Its Piper's forceps are specially designed for the purpose of the delivery of the after coming head in the breech presentation. So this is your 10-star very important question. Okay, it's your 10-star very important question. Which forceps we can use to deliver the after coming head in the breech presentation? That is our Piper's forceps is the single best important forceps. So this is the image of the Piper's forceps. They can ask in the exams. Okay, so where the large strength will be there, and especially how we have to identify, this is the pelvic curve. Okay, so it's the more pelvic curve. Okay, more pelvic curve and long strength will be there for this forceps. So this is what we call as the Piper's forceps. So it is used in the, yes, delivery of the after coming head in bridge. So it's very, very important, right? So it's very important. So bacho, what we have studied here, the maneuvers is to deliver the head. Let me take completely. Okay. First, we have seen the two maneuvers to deliver the buttock. So that is the Finard maneuver and one more is the, yes, groin traction maneuver. This one we have used in the front bridge, and this one we have used in the complete bridge. Now we have delivered the shoulder. Sorry, we have delivered the buttock. Then comes to the shoulder. In the shoulder, we have used the maneuver. That is the low set maneuver. And then comes to the head. In the head, we have used the three things. One is Burn Marshall technique or Burn Marshall maneuver, and the second one is, yes, that is the molar flexion and shoulder traction. We can say, and the third one is the Piper's forceps. Here, among these three, one, two, three, to deliver the head of the baby. So Piper's forceps is the best one. Okay, which one is the best here? The Piper's forceps is the best mode of the delivery of the after coming head. Okay, so this is the overall review I have given here. Take a short note like this in the extraction of the, sorry, in the delivery of the breech. So it's very important, bacho. I have taught you people the all important maneuver, that is, and important forceps, that is the Piper's forceps. This is the Piper's forceps. Okay, so Piper's forceps is the main purpose of the use is to deliver the after coming head in the breech presentation. Exact same questions with same options may comes in your exams. Okay, and here is the Burn Marshall maneuver. Very importantly, we have used it to deliver the head of the baby in the after coming head of the breech. Okay, so this is the we can say Morris's Murley Wheat techniques, or we can say molar flexion, shoulder traction techniques. Very importantly, this is also used for the delivery of the head. Okay, so then other things we have discussed in detail or completely. So hope that today's class is helpful for you all. Yes. So and very importantly, all people, there is a very important news for you all. As many of you know that Norset 8 test series is live in our application, where the very updated questions, very important questions, are rank deciding questions, are repeatedly asking questions, and the questions which may strike in your upcoming exams are completely with the rationally, with proper correct answer. So we have installed in our application in our Master Nursing Classes app. The app is there in the Play Store, and the app is available for the iOS, Apple, or we can say iPhone users also. So please download the Master Nursing Classes app if you want a good rank in the exams. Don't regret after watching the PDF which comes from our multiple choice questions, or we can say the NORCET 8 test series. The questions will directly strike in the NORCET 8 exams. So after seeing that one, you people will get regret. So I want my students not to get regret. So it's very low and very low price we have kept there. Okay, that is for the maintenance of the team, technical and engineering team. We have kept the very small price. Okay, so if you want that one, so take a use of that one. So all you have to do is to go to the Play Store and download the Master Nursing Classes app. Right, so we are having a many WhatsApp groups where we are daily discussing the questions, and we are sharing some updates. We are sharing some offers for the purchase of the courses. Okay, and we are sharing daily morning notes and night notes on daily basis. Okay, so stay tuned, stay connected in our WhatsApp groups also, Telegram group also. So I will give the link of that one in the description box. If you want, you can join there. Hope that today's session is very much helpful for you all. So as on your demands, so this is the important maneuvers I have covered in the yesterday's class and today's class. So next class will be on the, yes, ECG I will cover. Then after that, the mechanical ventilator I will come. Okay, so don't you people have to worry about that one. Stay tuned, stay motivated, stay engaged in the learning, so it improves your knowledge. Okay, so we'll meet again in the next class. Tab tak ke liye Jai Hind, Jai Bharat. And don't forget to subscribe to the class and hit the like button. Okay, so and join to our WhatsApp group. The link is there in the description box and in the comment box also.